A few extra inches can cost more than a house. The bill does not end when the surgery does. Private limb lengthening procedures in the United Kingdom have been reported at prices ranging from about $50,000 to $240,000. Similar procedures advertised in Turkey have been listed around $28,000. The amount depends on the country, the clinic, the method, and the care included in the quoted price. That's crazy. Money is only the first layer. The body then faces a long healing process. Daily movement can become difficult. Rehabilitation becomes part of ordinary life. Medical complications can change the result, and some can remain after the desired height has been reached. The invoice is only the start. The rest of the price appears in the body, the calendar, and the risks that follow the operation. The highest number in that range is not simply a bigger version of the lowest number. It signals how widely the total can vary before a person even begins to think about healing, rehabilitation, or complications. The quoted figure is therefore a starting point for comparison, not a complete promise about the final financial burden. A lower advertised price and a higher private price may involve different methods, clinics, countries, or arrangements for care. That difference matters because the operation cannot be separated from what happens afterward. A person is not buying a measurement alone. The person is entering a process that the body must complete. The central question is not only how much does the operation cost, it is what must someone spend, endure, and risk to reach the result. Hey, it's CJ, the creator of this channel. If you want to make YouTube videos like this, then topic2video.com will handle everything for you. Just input your topic, choose a video length, and a full-length video about your topic will come out the other side. I know it sounds simple, but it's true. Try it for free today at topic2video.com. Height surgery is a cosmetic use of limb lengthening. The technique also has medical uses, including cases where a bone needs to be lengthened or repaired. For a healthy adult seeking more height, the operation changes stature by choice. The men who consider it may feel deeply unhappy about their height. Some hope that becoming taller will improve their confidence or make social situations easier. Those hopes can matter enormously to the person making the decision. The person must also live with the physical demands after the operation. A clinic can give a price for the operation. The real price also includes the time after surgery when the person must heal and learn to move while the bones recover. Check this out. A bone is divided and the two sections are gradually moved apart. New bone forms in the space between them. The medical reality is far more demanding than that simple description suggests. The procedure changes the structure of the leg. The body must create new bone while nearby muscles, nerves, joints, and soft tissues adjust to a new length. That is why limb lengthening remains major orthopedic surgery even when the goal is cosmetic height. The phrase cosmetic use describes the goal, not an easier version of the operation. The bone still has to heal, and the surrounding parts of the leg still have to adapt to the change. This is the basic idea behind distraction osteogenesis. After the bone is divided, the space between the sections becomes the place where new bone develops as the sections are gradually separated. That explanation is simple, but the body has to coordinate many connected structures while it happens. A longer bone can affect the way the leg moves because muscles, nerves, joints, and other soft tissues are connected to it. If those tissues do not adapt comfortably, the desired measurement may come with a functional problem. That is why the phrase more height hides several separate questions. Will the bone unite properly? Will movement remain usable? Will rehabilitation restore function? Will a complication change the results? The operation is chosen for an appearance-related goal, but the work required to pursue that goal is orthopedic work. The cosmetic label does not remove the medical complexity. Doctors use two broad methods to hold and lengthen the bone during recovery. The first method uses an external fixator. This frame sits outside the leg. Pins or wires connect it to the bone through the skin. The frame supports the limb while doctors gradually separate the bone sections. The second method uses an internal lengthening nail. This device sits inside the bone. It lets the bone lengthen from within, so the visible hardware differs from an external frame. The methods create different practical problems. An external frame puts metal through the skin. An internal nail places the device inside the bone. The method affects the monitoring doctors use and the complications they must watch for. The operation is one event. Bone healing takes much longer. After doctors divide the bone and begin lengthening, the body must build new bone in the growing gap. Nearby tissues must adjust as the limb gets longer. Joints can become stiff. Movement can become restricted. Therapy helps the new length function as part of a living leg. A few inches on a measuring tape can require a large change inside the body. The result is measured vertically, but the work continues throughout recovery. The external frame makes the connection between the device and the body visible. Pins or wires must cross the skin while the frame holds the lengthening structure outside the limb. The internal nail changes that arrangement rather than erasing the underlying task. The device is inside the bone, but the bone still has to produce new tissue, and the nearby structures still have to tolerate the change. This distinction matters when risks are compared. A complication figure from an external frame study cannot automatically describe a patient with an internal nail, just as an internal nail result cannot be treated as the rate for every external frame. Both methods turn a short surgical event into a longer biological process. The cut is made at one point in time, but the final result depends on what happens during separation, healing, movement, and therapy. The measuring tape records the outcome in a simple way. It does not record the effort needed to make that outcome part of a functioning leg. Time is one of the costs. Recovery involves prolonged healing, limited movement, rehabilitation, and repeated monitoring. A person may spend a long stretch of life planning around the injured and lengthening limbs. Standing, walking, traveling, and completing a normal day can become difficult. The stage of healing and the medical team's instructions affect what the person can do. No single schedule fits everyone. The method, the person's body, the amount of lengthening, and the progress of healing all affect the timeline. The height change has a clear number. Recovery ends at a less certain time. Physical therapy becomes part of daily life. It helps the patient manage the changes caused by lengthening. Doctors also monitor the bone and nearby tissues. This work continues after the dramatic moment of surgery has passed. Pain is another part of the price. The body heals from a major orthopedic procedure while new bone forms. Ordinary movement can become demanding, and rehabilitation requires more effort. A clinic can receive its payment while the patient continues to pay with time, independence, physical effort, and interrupted plans. The invoice stays fixed. The lived cost changes from day to day. Recovery is difficult to summarize because it is not one moment called after surgery. It is a chain of stages in which healing, movement, therapy, and medical review remain connected. Restricted movement can affect ordinary independence. A task that once required little thought may now need planning around the condition of the limbs and the instructions from the treating team. Rehabilitation is not an optional extra added after the real treatment. It is part of making the changed limb work. The body has to heal while the person works toward useful movement. Monitoring matters because the bone and surrounding tissues are changing over time. A problem discovered during recovery can alter what happens next, which makes the calendar part of the medical uncertainty. This is why a recovery timeline should be described carefully. The treating team and documented case material are the right places to establish an individual schedule. One person's timeline cannot become a rule for everyone. The promised result may be expressed as a number, but the route to that number is lived through repeated physical decisions. External fixation carries a risk from the frame itself. Metal pins or wires pass through the skin into the bone. Each opening breaks the skin barrier, so infection can develop there. Doctors call this a pin tract infection. The infection follows the path around the pin from the skin toward the bone. Orthopedic literature identifies it as the most frequent complication of external fixation lengthening. Some reported series placed the rate close to all treated patients. One report reached up to 100% of its study group. That figure describes one study. It does not predict what will happen to every patient. The rate changes with the time the frame stays in place, the materials used, the surgical approach, and wound care. The reviewed literature says many pin site infections can be treated. The risk still matters when someone considers the procedure. A review of aesthetic lower limb lengthening found pin tract infections in 56% of 590 patients. The same review reported knee stiffness in 12% of cases, malunion in 7%, and refracture in 4%. It also reported peroneal nerve palsy in 13% of cases. Malunion means the bone heals in an imperfect position. Refracture means the newly formed bone breaks again. Nerve palsy can affect nerve function. Each problem can change movement, strength, sensation, or future treatment. The goal may be extra height. The medical team must also protect the function of the leg. The reason pin tract infection is such an important risk is visible in the design of the frame. The skin is normally a barrier, but a pin creates a route through that barrier into the limb. A rate approaching all treated patients in some series is a warning about the method's vulnerability, not a prediction that every case will be equally severe. Infection can be reported without meaning that every infection produces the same outcome. The range of reported problems also shows that infection is not the only concern. Stiffness can limit how a joint moves. Malunion can leave the bone aligned imperfectly, and refracture can threaten newly formed bone after it has begun to heal. Peroneal nerve palsy adds another kind of concern because nerves help carry signals involved in movement and sensation. A problem involving nerve function is different from a problem involving the position or strength of the bone. These terms make the risk more concrete. The issue is not merely that a procedure has side effects. A complication can affect alignment, joint movement, bone strength, or nerve function. The extra height is the intended result. Preserving the leg's useful function is an equally important part of what the treatment must accomplish. Internal nails remove the external frame from view. They do not remove the possibility of complications. A large cohort study of internal lengthening nails included 257 patients and 314 nails. It reported that 53% of patients experienced at least one complication. It also reported permanent sequelae in 9% of patients. A sequela is a lasting effect left by an illness, injury, or treatment. Here, permanent sequelae mean that some patients in the study had a continuing consequence linked to the procedure or its complications. These findings come from one study. They are not an individual prognosis. They do not mean every person with an internal nail will experience a complication or permanent harm. They show why a modern device still belongs in a serious risk discussion. The internal method and the external frame evidence concern different groups and different hardware. Their complication figures should not become one universal rate. Each method has its own medical history and its own demands on the body. The person chooses before the final result is known. Payment happens early, recovery unfolds later. The hope for change in height still depends on healing and complications. The internal device can make the outside of the limb look less dominated by hardware, but appearance is not the same as safety. The nail still participates in a process that depends on bone healing and tissue adaptation. The cohort result is especially important because it separates two ideas that are often confused. Having at least one complication is not the same statement as having a permanent sequela, and a permanent sequela is not the reported outcome for every patient. Reading the study correctly means keeping its population and method attached to its numbers. The result belongs to that studied group of internal nail patients. It should not be stretched into a universal forecast. The decision involves more than money. A man may have spent years feeling unhappy about his height. He may believe that becoming taller would improve his confidence or make social life easier. Research on height dissatisfaction has used the term height dysphoria for the psychological burden linked to feeling unhappy with one's height. That experience is personal. The desire for height surgery should not become a joke. Surgery also cannot promise to solve every concern about appearance or social confidence. The operation changes bone length, but the hope attached to that change can be much larger. The body can gain height, while the reasons for wanting it remain complicated. A person may feel satisfied with the result. Another person may need further treatment. The evidence does not provide a simple emotional guarantee. A price on a website can look definite. The full commitment also includes the method, the care around it, the recovery demands, and the medical risks. Those details show what the payment means in real life. Someone choosing the operation is putting a large amount of money behind a deeply personal hope. That hope can demand a great deal from the body. The cost of height includes more than the clinic fee. The operation changes the bone and starts a long healing period. During that time, movement can become restricted and rehabilitation can require daily effort. Medical teams must monitor the bone and surrounding tissues. External frames can bring infections where pins cross the skin. Internal nails can also lead to serious complications. The studies behind these risks examine different methods and different groups of patients. Their numbers do not guarantee one person's outcome. They show the range of consequences a patient must discuss with an orthopedic team before deciding. The desired result can be counted in inches. The rest of the price has no single unit. Money appears on a receipt, pain changes during recovery, time fills the calendar, medical risk remains possible until healing is complete. An advertised fee tells you what may be paid to begin the process. It cannot by itself show what the process will demand from the person living through it. Limb lengthening surgery offers a chance to become taller, not a guaranteed life change. The person who chooses it must live through the healing, rehabilitation, restricted movement, and medical uncertainty that follow. Wanting to be taller is a personal decision. Understanding the exchange means seeing the full price before agreeing to pay it. A few inches can change a measurement on a wall, but reaching them can change daily life for months or longer, depending on recovery. If you want more documentaries that turn a simple price tag into the full human cost behind it, subscribe to the channel. Hey, it's CJ, the creator of this channel. If you want to make YouTube videos like this, then topic2video.com will handle everything for you. Just input your topic, choose a video length, and a full-length video about your topic will come out the other side. I know it sounds simple, but it's true. Try it for free today at topic2video.com.